I want to thank everybody for joining us here today. For those of you who I haven't met, my name is Dan Schnur, and I'm the director of the Unruh Institute of Politics here at USC. And we co-sponsor these lunches every Wednesday, along with our friends at the Schwarzenegger Institute, and also our friends at the Daily Trojan. And in just a minute, you'll meet Reiss and Annalise Mantz from the Schwarzenegger Institute and from the Daily Trojan. But for just another minute or two, I'm going to hog the spotlight before I turn it over to them. Today's discussion, as I think you know, is on healthcare policy, on the passage of the Affordable Care Act, and in particular, the Act's impact on young people. One of the things that we'll hear from our panelists here today is a relative lack of knowledge that many Americans of all ages have about the Act. And so while we certainly want to talk about the broader impact of healthcare reform's passage, we also want to focus today, at least particularly, on the Act's impact on all of you. We gather here every week for a different set of policy conversations. We're particularly excited for this one about healthcare. And I'll just ask you, before we get started, just a couple of things. One, for those of you who've been here before, you know that we spend roughly the first half of each hour with our moderators asking questions of our panelists. And we've got a terrific set of panelists here today. Policy professionals, one of the leading lights of USC's faculty, and two of the more impressive members of USC's student body. And for those of you who are SC students who are particularly interested in a specific policy topic, let us know at the Unruh Institute or at the Schwarzenegger Institute, because we really do make sure that as much of our programming as possible includes not just professional and academic experts, but student experts as well. If there's a particular topic in which you'd want to engage in conversation, we'd be happy to work with you to put together a program that gives you a chance to talk about it. So let us know. After the first 30 minutes or so, Bonnie and Annalise will open the discussion to questions from all of you. And as Bonnie will remind you at the time, number one, we'll ask that when one of them calls on you, we'll ask that you identify yourself so we know who's participating in the conversation. And second, we'll also ask that particularly if you're going to put a question to someone with whom you may have disagreed on something that you've heard, we ask that you remember that person's not your enemy. They're not a bad or an evil or a stupid person. They're a really smart, public-spirited person just like you who happens to have come to a different set of conclusions than you have. And so we'd ask that you frame your question to them with the same level of respect and regard that you'd hope that they'd show for you if they were questioning you. We're very glad that you're here today. Next week, just quick advertisement, a week from today, we've got a terrific discussion, a look back at the 2012 presidential election. Dan Balls, the Washington Post senior political reporter, who's the author of Collision 2012, will be here, as will Lynn Vavrick, the author of another excellent book on last year's campaign called The Gamble. And if you want to hear a discussion not just about last year's campaign, but how it impacts California and U.S. politics going forward, we hope you'll join us for that. Anyway, we're very glad you're here with us today. With that, let me turn it over to Bonnie and Annalise.
Thank you, Dan. Too bad Dan's not in D.C. giving those rules of respect and working together to our national leaders.
I know my limits.
I'm Bonnie Reiss. I run the Schwarzenegger Institute. We launched here at USC with our partnership with USC a year ago. And we're so pleased that Dan and the Unruh Institute reached out to us to partner with them and the Daily Trojan on these important student talkback forums, which bring you interesting topics. And today's topic couldn't be more timely. And obviously, with only an hour, we know that on any of our important topics, we can really only touch some of the top important points with it and engage you in some of the dialogue and good thinking on it. Any of you that are watching the news know that the House Republicans continue to try to repeal Obamacare, also known as the Affordable Care Act, and if they can't repeal it, they're talking about delaying sections of it. But right now, the Affordable Care Act is the law. Yesterday, the California Exchange opened, as did changes throughout the country. So today, our focus is not debating should it be the law, shouldn't it be the law, or what's going on in Washington, as interesting as that may be, or sad. But it's to really discuss what is the Affordable Care Act, and in particular, how it impacts you. And we're very grateful to have such a remarkable group of people here to talk to you about this. So without further ado, Annalise, I guess I will introduce the four people that we have here with us today. We have Tamika Butler here, who is the director of the Young Invincibles. She's the California director of Young Invincibles. And all the top people with the California Exchange that are running this that we talked to say who's the best suited to speak to the impact of young people, everyone kept saying Tamika. You've got to get Tamika. So we're very grateful to have Tamika here. We have a senior at the USC Price School of Public Policy, Julia Wick, a brilliant young student, another example of why USC is becoming the greatest school in the world. And she's very knowledgeable about this, and it's a pleasure to have her here with us today. We have Dr. Dana Goldman, one of the greatly nationally regarded researchers on healthcare policy, healthcare, the economic impact of healthcare, the health impact of it, and the founding director of the Leonard Schaeffer Center. So thank you, Dana, for being here with us. And then we have Sarah Axeen, who is a Ph.D. student. And just to show you how knowledgeable she is, when we were in our pre-meeting and said to Dana, Dana, we think we should go to you first to talk about what are the key provisions of what is the Affordable Care Act and what provisions impact young people. He goes, oh, no, not me, Sarah. Sarah's the one that's the expert and has read the act beginning to end. So we're really grateful to have this, and let's get this discussion going. And with that, I introduce the editor of the Daily Trojan, Annalise.
Thank you. Well, to start, I'd like to get into some of the nitty-gritty components of the Affordable Care Act. And Sarah, I know you studied this quite a bit. Maybe you could give us a brief overview, some of the highlights of what the Affordable Care Act means.
Sure. So I'll touch briefly on sort of the coverage expansion portions of the Affordable Care Act, as they seem to be sort of what is most important to young people. With the passage of the Affordable Care Act, there were two new avenues for people to gain health insurance coverage. One is through an expansion of Medicaid, which is called Medi-Cal in California, and the other is through the setup of these health insurance exchanges. And on these exchanges, private companies will be offering health plans, but unlike the individual market that people faced prior to the Affordable Care Act, there's some new regulations, among which are that there's no health rating in these health plans. They can only rate based on age, smoking status, and region of the country. In addition, there are no pre-existing condition exclusions. And within these plans, there are going to be about 4 levels of coverage that range from covering about 60% of your costs to about 90% of your costs. And so you can elect among those different options based on sort of whether you feel you need more coverage and less out-of-pocket payment, or more willing to take a risk on your health status. In addition, one of the most important provisions of the law is an individual mandate to purchase. So all people will be required to have health insurance by January of next year. If they don't, they'll face a penalty of about $95 for an individual and about 2 to 3 times that for a family. So those are sort of the basic structures of what goes on with the Affordable Care Act.
Thank you for that overview. And Tamika, we're going to have a follow-up to give further clarity to that. The young people are the largest uninsured group of Americans, which is what the Act is trying to get at. So when Sarah was telling us about the individual mandate, what exactly are the requirements? So like how long do individuals who, if you're covered by business, which individuals? Do students have to get covered? And if not, how long do they have to get covered? And how will these penalties be assessed on them? And what's the likelihood young people will choose that, even though they have to get covered, to actually get the coverage versus pay the penalty?
Yeah, those are a lot of questions. So let me do my best. So I think a couple of things. Some of the other parts of the Affordable Care Act that are huge for young adults, who are, again, the most uninsured population. So, young adults are just going to be really, really important to make this whole thing work. And here in California, young adults are even more important. So nationally, there's about 27% of 18 to 34-year-olds that are uninsured. Here in California, that number jumps up to about 30%. And here in LA County, that number jumps up to 39%. So if you look around at your friends and you talk to them, what you'll find out is a lot of them are insured. And when we've talked to young people, there's this misconception that young people aren't insured because they don't want insurance. So the name of my organization is Young Invincibles, and that's actually a term that insurance companies use to describe this age group, 18 to 34-year-olds. And the logic has been, don't waste your marketing dollars on them, don't try to get them insured, they don't want it, they're young, they're relatively healthy, and they think they're invincible. And as many people know, I'm pretty clumsy, so I know I'm not invincible. I've broken my wrist a few times, I often trip while walking, I've mastered tripping while walking upstairs. we all know people like this. We all know young adults who actually do want insurance. There's, you're playing a pickup game of basketball, you think you're Chris Paul, you go to do a crossover, you tear your ACL, and you pay as much going to the emergency room as that one night as you could spend on one tuition of college. So we know there's young people like that who want insurance. Our young people who have cancer, and before the Affordable Care Act, student health plans weren't really regulated. Now they are. And so you can't cap out on coverage. So there's all these stories of young people before the Affordable Care Act who would be getting chemo, hit their cap on their student health plan, and then just be stuck and have to drop out of school because they couldn't afford coverage. So we actually think that young people are going to get covered. We think that young people do want coverage. All the surveys show that when actually asked, young people say a couple of reasons they don't have it. One, I can't afford it. That's number one. Like, the recession is real. Money is a major issue. I can't afford this. The second thing is I have a pre-existing condition. The third thing is I'm too old to stay on my parents' plan. And the last thing is I don't have a job, so I can't get insurance. Young adults have an unemployment rate twice that the national average. And so really, all of those issues that I just mentioned are going to be addressed by the Affordable Care Act. You could stay on your parents' plan until you're 26. There's going to be more affordable options. Even if you don't have a job, you're going to be able to qualify for this Medi-Cal expansion. It's all these things are going to be really addressed. So we think now that all of those things are being handled, young people will actually sign up.
Great, and maybe now to go to Dana. What does the Affordable Care Act need in the implementation phase to succeed economically?
Well, I think actually we focus on the implementation phase, but that's actually not the big issue. We don't need to get this law right the first time, and there will be, when you're talking about insurance, it's very difficult to get it right because it's a complicated market. We didn't know how many young people were going to sign up. We have some penalties. Are the penalties strong enough? Are the subsidies great enough to get people to enroll? And remember, you're talking about a population that we didn't know a lot about their health because they haven't been in the system often, and so we don't know what their undiagnosed disease. So I think although implementation is what we're focusing on right now, the real question long-term is whether we can provide an affordable option that will get people to play in the market and actually cover all the people we want to cover. So the other big issue facing the country is the long-term fiscal crisis. And really a lot of that is being driven by the inflation in healthcare costs. And so for this law to be successful, we actually have to do some other stuff that has nothing to do really with covering people, which is we need to tamp down the rate of growth in healthcare spending, and the law doesn't do a lot to address that.
Thanks, Dana. The next question we wanted to say is, Julia, when we were chatting with you earlier, you've done a lot of studying and looking at this, and you had some very interesting things to say about how this has a particular impact on women. Can you address some of that with our group?
Not just as a young person, but as a woman, I feel really strongly about the Affordable Care Act for a number of reasons. In the past, we've all heard a lot about how pregnancy can be considered a pre-existing condition, how a woman can be dropped from her insurance for getting pregnant or not be covered because she's pregnant. But domestic violence could also be considered a pre-existing condition. A woman could be dropped from her insurance. She could not be able to get insurance. And to me, that doesn't really fiscally make sense or morally make sense. Women have also been charged more than men for the exact same health coverage, both in terms of higher premiums and out-of-pocket costs, which isn't great when we're already making 77 cents to the dollar. So that the Affordable Care Act will also regulate that. Women will no longer be allowed to be charged more than men. And there's also quite a few things having to do with preventative care that affect the Affordable Care Act overall. But in terms of women, things like mammograms, yearly mammograms will be covered without a copay. Prenatal coverage will also be a part of it, and current estimates show that at least 87 million women will gain maternity coverage through the Affordable Care Act, which again are things that are important to long-term health.
And going off Julia's response, I wonder, Tamika, if you could talk a little bit about when you're out there interacting with young people educating them about healthcare. What are some misconceptions you see about the Affordable Care Act or getting covered?
Sure, I think the first thing is a lot of people don't even know what the Affordable Care Act is, quite frankly. You know, you say the Affordable Care Act and people just kind of like glaze over and they're like, who are you? Why are you talking to me? I think Obamacare is really what people recognize, for better or worse. Or just saying healthcare, like changes coming to healthcare. I think even more people recognize that than the affordable healthcare. The other misconception we're hearing is that it's not happening, especially with everything that's happened in the last few days, with the government shutdown. A lot of people just don't understand that this is actually a law, it's been passed, and it's gonna happen, which makes some of the things that are happening now even more absurd. And so I think that's something that people just don't realize. The other thing that people don't realize is that coverage doesn't actually start until January 1st of next year. So there's really this big push to get everybody signed up, and there's this period called the open enrollment period that's going to go the next few months, but actual coverage won't start until January 1st of 2014. So I think that's a pretty big misconception. And then I think the other thing we hear, and we've all touched on this a little bit, is just that young adults don't want health insurance, and I think that's a pretty big misconception that a lot of people are starting to kind of overcome. And more than just young adults, people think no one wants healthcare. You know, I don't want the government involved in my healthcare. This isn't going to happen. But yesterday, when the exchange opened up, Covered California, which is the name of our state exchange, actually got 5 million hits on their website. They got so many hits on their website that they had to close the website overnight, get the IT people in to kind of make it better for today. Similarly, the national website, healthcare.gov, got millions of hits. And so the idea that there's not a desire for this probably isn't as true as all of the, you know, back and forth between the two parties is showing.
Thank you. Julia?
I will say, though, about 2.5 million of those hits were from journalists.
Julia and Sarah, we keep hearing that the importance of this is like, we're hearing that you're saying that a big percentage of the young people not insured is because they want it, but it's too costly. For this plan to succeed, says Dana, the economics are key, and, you know, will the subsidies versus the penalties get young people to actually get insurance? So, Julia, you were mentioning, like, for a 25-year-old freelance, what are the different available cost of insurance? What kinds of insurance can young people get now through the California Exchange or through Obamacare?
Well, to address first what you just said about why it's so important for the ACA to succeed, having young people register, is that young people will actually be paying a little more than their actuarial value. And if young people don't enroll, it'll just be like the old sick people, and the whole thing won't work. That's really what the mandate means, is that everyone has to enroll in order for it to work financially, which I'm sure Dana can talk about far more eloquently and knowledgeably than I can. But in terms of what it will actually cost, I was playing with the exchange website, and a 25-year-old freelancer in California could get a bronze plan, which is one of the lower plans, the lowest above the catastrophic plan, for as low as $117 in Los Angeles. That's probably lower than it'll be. It'll probably be around $150 a month. But and that might sound like a lot, especially when the penalty is $95 a year. When you think about it and you break it down, 30 days in most months, that's $5 a day. I know plenty of young people in the room who are holding Starbucks lattes that probably cost them $4, and young people who worry about money and spend $5 a day often. You know, it's affordable. It's something that we can pay for. And again, even though we might be paying slightly more than our actuarial value, young people will also be the population who will be helped the most by tax credits. We'll get a disproportionately large subsidy, and it's because we're probably the least employed, but we will still be helped the most by the subsidies.
Sarah, did you want to touch on that?
Yeah, just to tack onto that, I just wanted to mention a couple other portions of the law as they relate to young people. One of the most important is that kids who are on their parents' insurance can stay on their parents' insurance until they're 26, which is a huge boon to a lot of people who are living in states where normally you got kicked off as soon as you were finished with school or were no longer a dependent. You can actually be on your parents' insurance even if you live, in another state and are no longer on their tax forms or anything like that. And the other thing that Julia touched on is that specific to young people, there will be catastrophic plans that are available to people under the age of 30. And those will cover about 3 preventative services a year for a low cost, and then we'll have sort of a high deductible and will stop you from having catastrophic medical expenses, but you won't need to pay for sort of the other mandated benefits that are covered under those gold, silver, and bronze plans.
And to follow up about the catastrophic plans, maybe you could expand on that a little more? I know that's something I wasn't personally aware of before today.
So it's another portion they put into the law to try to entice young people to sign up. Basically what it means is it covers you from catastrophic out-of-pocket costs. So say you land in the hospital and it costs $30,000 for your stay. These plans will kick in for that kind of coverage, but they're not gonna cover your visit to the doctor because you have an earache or strep throat or things that are sort of more routine and can be cared for in a lower cost way.
Right. And Dana, maybe to follow up with you, we talked a little bit about subsidies versus the penalty that you will incur if you don't get health insurance for a young or a single person with about $95. Do you think that's a strong enough economic deterrent for people to go in and buy health insurance?
Probably not. And originally the subsidies, so there's an interesting part of this. There's an individual mandate. People have to buy insurance. And this law, I thought Julia did a good job speaking about it so eloquently. It's about solidarity, so we could all get together, and if the young people agree to pay some money, when you get older, you'll contribute. That's actually not the way American society responds to incentives. American society responds to financial incentives. We've seen this over and over in health insurance, and the financial penalties, so the individual mandate by itself isn't going to have a big effect. And the Congressional Budget Office, for example, knows this. So the question is, are the penalties big enough so that, we could put people in jail if they don't have health insurance. That would have made the debate even more interesting if we proposed that. But they started off with very low penalties and very big subsidies. So the prices are about, what'd you say, $115 a month? That's not so expensive. But again, the question is, are the benefits too generous? Will they grow over time? So next year, what if it turns out that not enough young people enrolled, and so the monthly premium is now $200? Then that $95 penalty may not look as bad as it is, or if the subsidies were so expensive that they had to ratchet them back. And so I really think, again, I don't think we have one bite at the apple. We need to figure it out. We can't predict because insurance markets are difficult to just understand how the risk pool affects the rating. So we need to see what happens. But I do think if we can get, and I know you don't want to talk about the political environment, but if everyone said, can we make this law work? The answer is actually yes. We just need to figure out, maybe we should be a little less generous, maybe we need some more penalties, maybe we need to do something about healthcare costs.
And the penalty is going to be $95 or a percentage of your income. And for a lot of people, if you're willing to pay the penalty because you literally can't afford it, there's actually options where it will be affordable. Like if you make so little money that the penalty's better, then you probably make so little money that you can get on Medi-Cal, or that you can get one of these huge, credits from the government. Or the other thing that we always try to explain to people is $95 is the fine this year. So for some people, like if you make that choice, like, hey, I'm just gonna pay the fine and that's gonna happen, totally cool. But like also shit happens, right? So like you can get in an accident. If you get in an accident and you go to the doctor for one night, it will cost more than $95. As young people, we're super concerned about our financial aid and our student loan debt. As someone who went to Stanford Law School and was told I was going to get financial aid, I can tell you I am now paying a lot of money I don't have on student loans. But the reality is more young people have debt from healthcare bills than they do from student loans. And that's just crazy. If you're, if you go to the hospital for one night, you're gonna have more debt than you will for some young people than if they go to college for 4 years. And the reason is because we go to the ER all the time. 18 to 34-year-olds use the ER more than any other age group except for seniors. Because when we do hurt ourselves playing basketball, we limp like it's cool until we like literally can't walk anymore. When we have a cough, we're like, no, I'm good. I'm good. Until like we have asthma and we're falling out, right? And so then when we go to the ER because we don't have a regular doctor, then we're paying more than that $95 penalty. And again, that penalty is gonna go up every year. And I'm very, very young. So I don't remember what it was like to not have seatbelts in cars, but I hear from old people in my life that there used to be this time where you could buy cars without seatbelts. And then slowly there were these penalties that were put into law. If your car didn't have a seatbelt, you'd get a ticket, and now you just can't get a car without seatbelts. Like you just can't. Because there's just been this shift in our society that you're not an idiot, so you'll have a seatbelt in your car. Now there are some idiots who don't wear their seatbelts, but you have to have a seatbelt in your car. The same thing is gonna happen with healthcare. So even if you don't get insurance now and you just pay $95 now, at some point you're gonna have to make that shift in your life where you get into the culture of buying healthcare.
Dana, first I have to say that it's not that we don't want to talk about the politics. It takes a lot of discipline for us to resist talking about the politics.
Yeah, that's right. Yeah.
But we thought with this limited amount of time, and the fact that the exchanges started yesterday, it's more relevant to try to talk about what is versus the politics going on. But it's clear from what you've all been saying that the $95 penalty is not what's going to be getting the young people to subsidize old folks like me and Dan Schnurr. So Tamika, I go to you and I say to you, I know that the government has given and foundations have given hundreds of millions of dollars out in grants for public education campaigns. So what's being done and what's the gist of, is it Shit Happens campaign? Well, how are young people being targeted to try to get them to sign up if this is going to be successful?
Yeah, I think it's a couple things. I think it's realizing how to talk to young people. If anyone goes to the Covered California website or like sees the flyers they hand out, there's a lot of these really glossy things with these really cute, perfect families with 2.5 children smiling and rolling around in the grass who are like multiracial or ambiguously ethnic so that like everyone identifies with them. But I think, part of what a lot of foundations and groups are starting to realize is we actually need to see other young people. Like seeing this family, though there are a lot of young people with families. I have this staff member who gives a presentation, and whenever she's talking about how to talk to young adults, she's like, and please don't talk to us about families and taking care of our families. I only care about myself. And then like she always stops and she's like, I don't. I love my mom, but I do only care about myself. So I think there are a lot of groups out there trying to talk to young adults and remember that we have some different concerns. There's different ways to reach us. And this real idea that there's some power in storytelling. It means a lot more to see other young adults who look just like us, who have been through similar things, who have had like a crazy night at the frat house and that's what ended them in the ER. It's a lot easier to see those stories and realize the importance of healthcare. There's a lot of celebrities. Our organization has been in a number of meetings in the White House with a lot of celebrities who want to step up. The latest has been Jennifer Hudson did a really good Funny or Die skit where she pretended to be on the show Scandal. How many people watch the show Scandal? If you're not raising your hand, you should feel very bad. You should be watching. You should be watching the show Scandal. It is addictive. And so there's a lot of celebrities. coming out and really making a statement that this is important. And then, the other thing is really this use of technology, videos on YouTube. We have a video contest right now where young people submitted their videos. There are a lot of young people who have submitted rap videos to us, but videos about why it's important, and then really integrating social media. And so the most important thing with getting people to sign up for healthcare is really reaching them where they are, where they play, where they work, where they're educated, where they worship. And for young people, all of those things happen online, right? Like we do all of those things online or on our cell phones. And so our organization and a lot of other organizations have developed different cell phone apps to really get young people the information they need about healthcare. And whenever I talk to my dad about this app, he's just like, I don't get it, I can't see it, what's going on? And I explained to him, like, I'm originally from Nebraska, and I have a lot of friends in Nebraska. Yes, there are black people there. And whenever my dad's like, did you hear about so-and-so had a baby? And I was like, yeah. He's like, oh, you called her? You wrote her a letter? And I'm like, no. I stalked her on Facebook one day when I was supposed to be working. Or when my dad, who's a military guy, is like, how are you gonna get here? Like, what does the map say? I'm like, map? I just put it in my phone. I turned when it told me to turn, right? Like we do everything on our cell phones. So a lot of the information for young adults is gonna be accessible on cell phones. And I do think that young people are important for this law to work. And not just because of the numbers everyone's talking about, but because in so many communities, especially communities like mine, where no one in my family went to college. So when I wanted to go to college, when I wanted to go to law school, I had to explain to my parents what FAFSA was. I had to get the information I needed. We see this in a lot of, families where they're not necessarily English speakers, where it's the young people who are translating forms for mom and dad. And so the other way in which young people are important is we're really gonna be the leaders to get other people in our communities insured. You saw the same thing in the presidential election where young people were key in getting other people out to vote. It's the same thing with health insurance.
So one last question before we open it up to questions from the audience. I'd like to get Dana's perspective kind of on what Tamika just said about, are young people really going to be the driving force that makes this sustainable, or do we need to make more changes to the law?
Well, we haven't talked at all about the undocumented, for example. A lot of them are the uninsured who don't, right now, especially in California and also in Texas, and they're not affected by this law. And actually, if you ask about population health, there are going to be changes in the subsidies that go to the places that actually deliver the health care to people like the county, for example, who don't have insurance. And, there's a big difference, by the way, between giving someone insurance and giving someone access to health care. So my suggestion to all of you is you go get your checkup before January 1. Because on January 1, everyone's going to be calling doctors, and doctors say, I'm not taking any more Medi-Cal patients. My practice is already full. So it is true you may be out there hurting your knee, but it's going to be very hard to get into the orthopedic surgeon to actually get care. And we haven't talked about that. And really, if you want to talk, why do we have this law? Part of it is because of financial ruin, as you said, and we worry about bankruptcy. But the other part of it is we think this is going to move the needle on population health. And actually, the evidence isn't there. And so actually, if we really wanted to make people healthier, we might have had a very different reform. So that's a way of avoiding the question you asked me. So.
Okay, fair enough.
And I know that there are a lot of other issues of challenges that you'll be seeing coming up, like there's concerns of even people that support the law about shortages of healthcare professionals, and just the basic financial sustainability of this. And I also want to say that I'm proud to be in a state that takes leadership in so many things, including this. And whether it has negatives or positives and needs fixing or where we go, trying to figure out how to get uninsured people insured and trying to make sure that everyone that needs health care can get health care is a goal we all support. It's how we get there with it. We're having debates over it. And when Arnold was governor, actually, he was very much trying to figure out in California how to make this happen. and was the first to sign, first state in the country and first governor in the country to sign the law. So California would be at the forefront of trying to take advantage of this opportunity as we expand healthcare. So it's great to be in a state that is so forward-thinking on all these issues. And with that, I think we're going to open it up now for questions. And learning from Dan Schnur, who's done this for years, I would repeat that. Before you ask the question, if you could stand up, state your name, because we like to know who you are, and then state your question. We ask it not be a speech or statement, but hopefully a question, and be done respectfully. Right, Dan?
Yes.
Okay, thank you. Yes.
My name is Reiss, and I have a son who's currently on my insurance. He's 25. He will be 26 in November. So with the law and everything, do they just drop him to 26, and do I have to enroll him into something else?
Go ahead, Sarah.
I'm sure, but I can't provide insurance advice because I'm not a professional. I think through the age of 26, he can remain on your plan, but on his 27th birthday, he would be dropped from that plan.
26, he's fine.
Because he's 26, because you can stay on through 26, but at 27, he would no longer be eligible to remain on your plan.
And then
And
at
his
that,
options at 27, what does she do to find out his options
and then at that point, you would go to Covered California. So you would just go to their website, which is Covered CA, and then you would just, they have this whole, the best way to describe the exchange is it's just like Amazon or Kayak or one of those places where you go and you can just see all your options side by side. You put in your information, they even have a calculator so it can give you a general idea. And when you put in your information, so when your son puts in this information for himself, then this information will pop up and it'll say, these are the options available. Maybe at 27 he'll have a job and he can get coverage through his job. That'll be another option. If he's still a student at that point and he's at a school that has a student health plan, that'll be another option.
Because he has a job, but they don't have insurance.
And we haven't even discussed the delay of that mandate in terms of employer mandate.
Hey, Dan, did you want to ask a question?
I have a question. My question's for Julia. Although if Sarah would like to weigh in as well, that would be great. Julia, I heard Tamika talking about why it made all sorts of sense for young Invincible to sign up. Now you're young. You seem healthy. You're clearly invincible. And as near as I can tell, you have no need for health care whatsoever for many, many years to come. So my question is, are you worried that you're going to injure yourself the way Tamika tends to? Or are you just so selfless that you're willing to pay money so that old sick people like me and Bonnie can have health care on the thought that 30, 40 years from now somebody will have your health care?
What he really means is, could you go give him $100?
So, all joking aside, it seems like it would make a lot more sense for you simply to pay a $95 fee or penalty, not have to worry about all the rest of this. But from listening to you talk, it sounds like you've decided this is something worthwhile. How come?
Well, two things. Before I say the personal, as Tamika kind of addressed, statistics have really shown that it is something young people want. What's really interesting about the statistics is Kaiser did a study, and 71% of young people, I believe it was 18 to 34, said it was something that was personally important to them. But great, it's important to you. It doesn't mean, you feel like you need it. When they rephrased the question, is healthcare something you need? 74% said yes. Unfortunately, I am a lot like Tamika. I'm incredibly clumsy. I've broken pretty much every bone, had 4 concussions, just making my way through the world. So it's good if I'm gonna maybe be stopping in the ER once or twice every couple of years. It's nice that I won't be paying out of pocket. But we're really not invincible. And I think almost everyone in here probably has had a friend who something catastrophic happened to and seen that friend really beyond the medical repercussions be unable in a lot of ways to go on with their life because of the financial repercussions. A close friend of mine who wasn't able to get health insurance, who was 27, but his parents didn't have health insurance anyway, because of a pre-existing condition, then had serious medical issues happen and had to really choose between paying their rent or paying for prescriptions. And I feel like once it's been made a little bit personal, you then are kind of like, we're all human, we're all fallible. And the other thing I think is really important about raising the deadline to 26, which I believe since they've done that, what is the number, 3.1 million people have taken advantage of it, is that I'm 24, I graduated in December. I'm looking for a job in the nonprofit world. So not only is that, not a great place to get hired, but the likelihood of me finding a job where I'm gonna get health insurance at an entry-level position in the nonprofit world is pretty much nil. And so what that means is I can choose a job based on what I really want to do for the next 2 years, as a lot of young people who are getting out of college, and not necessarily take a job that isn't something, something more corporate or whatever, just because it offers health insurance. It really gives young people the time they need to figure these things out.
Did you want to weigh in on this?
The thing I was gonna just tack onto that is, having had to help my husband shop for an individual plan, I think one of the benefits of these exchanges is that they're a lot easier to understand. I, know this stuff backwards and forwards, and it took us a month to figure out a plan for him that made sense and was affordable. And I think, with these websites where it's side-by-side comparisons, that makes a huge difference in people's willingness to take up insurance, because it's just easier to do. So I think a big important piece of this implementation is how easy it is to get insurance, and if it's easy to do, people are that much more likely to do it.
Hi, Uriel Kim, biology and philosophy double major. It's my understanding that these exchanges are expected to help rein in the cost of healthcare, and on the other end, it's my understanding that providers are also expected to give a little bit back to the system. Is it a paradox that we're shifting towards a outcome-based method of reimbursement, which is making healthcare organizations kind of collude together to the detriment of private practices, because private practices are where the free market can really do its magic. So I'm asking, are we kind of inhibiting the free market from being able to act on the provider end of the spectrum through this bill?
For those that didn't hear in summation, the question is, is this bill inhibiting the free market approach in the healthcare marketplace?
So there are two markets that you referred to. One is the insurance market and one is the provider market. The insurance exchanges are actually they're a very conservative idea, and the point was to use the private marketplace. So there's a lot more insurer competition when you can price shop, just like Amazon promotes competition, or Kayak when they can compare flights or other goods side by side. So this actually creates competition in the insurer market. The question is, do we want it? So what's going on in the provider market, what the providers are doing is they're consolidating. So I don't know if anyone goes over to the west side, but I defy you to find a doctor who's not owned by UCLA at this point. USC is doing the same thing. All providers are actually getting into very large groups. And why are they doing that? I'd like to believe it's to improve the quality of care. But really what they're doing is they're negotiating better prices with the insurers. So actually, we may want big insurers because big insurers can actually hammer doctors on prices. And so there's a lot of market power that's going on, and none of that, by the way, was addressed. So the right solution to what you're talking about would be for the government to start to enforce antitrust measures against doctors and make sure they can't monopolize markets. But the thing is, if I asked you, do you like doctors better or do you like insurers better? I think most people would say they like doctors better. So, we had a speaker come in an event just like this who served in the Obama administration, and he basically said that there was there was a particular and direct strategy to make insurers the villains in the passage of Obamacare. So like you said, there were deals negotiated with all these groups. By the way, there was a deal with doctors on Medicare which would save $75 billion, and then right after the law was passed, Congress passed another law that reneged on that. So already we were out at 75 billion. So the bottom line is that these questions of insurer and provider market power are very important for the long run success and ability to provide health insurance, but they're not addressed in the law.
I feel compelled to do a follow-up question as one of those Americans that like my doctor a lot more than I like my health insurance
Right.
company. And that is with all these mandates, individual one, even though the business one's been delayed, it looks like for sure the only real winner out of this is the insurance companies, that they're going to continue to make even more money. So what are they being asked to put in the game to help this?
Yeah, that's a good question. And they're getting subsidies, and so they like it. So people are buying their products.
Right.
And so, but actually a lot of some of the big insurers aren't playing in the California market. There is a lot of uncertainty here. Actually, the real way they lost is something we're not talking about today, which is in the Medicare market, where they got hammered on the Medicare HMOs. So they've gained a little on the young people. When you insure, as you said, if we can get young people into the risk pool, the insurer can make a lot of money. But there's been some issues about what happens at the older ages.
And the other thing is the law requires insurance companies to give a certain percentage of what they get from us as the insured to our actual care, which wasn't the case before. So before there were just some companies where you'd pay money, but you weren't really sure where it was going to. It wasn't necessarily improving your care. And the law now says that has to happen, or they're going to have to give people money back. The other thing the law does that we haven't really talked about is that it requires that all insurance companies that are mentioned in the exchange and that you can look at in the exchange have these 10 essential benefits. And so when people say your healthcare really won't change, it will just get better, what they're saying is in the past, you might have to call 5 different companies, and some of them might cover prescriptions, and some of them might cover pregnancy, but some of them might not. And now the law says that any company that's on this Covered California website has to have these 10 essential things. So even if you're not a clumsy person like us, and you're just a person who needs like allergy medication, that has to be covered. If you're somebody like me who's very, very gay and is not gonna get pregnant unexpectedly, but still needs birth control for other reasons, that's a lot of money. If anybody gets birth control, you know how much birth control costs every month, and over the course of a year, that is well worth not paying a $95 fine. So it's all these types of things that are covered under these 10 essential benefits that all insurance companies now have to cover.
And you'll be happy to know that one of those essential benefits in California is acupuncture services, because we all know how important that is for health.
I love my acupuncturist. He's changed my life.
My son does.
Sorry to interrupt you guys.
Yeah.
I'm an MHA first-year student. That's health administration at the Price School. I am brand new to California. I'm from New York. So there are similarities in terms of being progressive, but I definitely agree with what Bonnie was saying that California is one of the more progressive states. Since it is progressive and it seems that they adopted the Covered California model early and developed it early, I was feeling positive about becoming a part of it, being a new student here, new to the region, and you talked about hundreds of millions of dollars towards education, and I haven't seen one advertisement, I haven't seen a TV commercial, a bus ad, I have not seen any education. Zero. Maybe it's because we're in a closed community here, but I live in West Adams. There should be billboards up. There should be people handing out flyers. It should be like a political campaign where people are knocking door to door to say, do you have health insurance? If you don't, please let me help you get signed up. And it be culturally confident, it be in their language, and there is none of that. And I've been reaching out for months to Cover California, and even as of the market being open, there's still no list of organizations that have been approved as education entities, as enrollment entities. In order to be an enrollment counselor personally, you have to be affiliated with an entity. So how can you help if you're someone in my position or some of my fellow students, how can you help educate the community without being associated with an entity that you can't legally find out the information about.
Yeah.
So it's this other hurdle. And in addition to that, some of the things that you all touched about, the $95, I believe that's a first-year penalty. So I think in 2016 it's going to be $695. So when it's $700, people are going to buy in. They're going to say, why not? But also playing around with the system, like searching, okay, I made however much being a waiter or bartender. Not that much. And the numbers were fairly low for my monthly. But when you start to look at the details, if you buy into a bronze plan, it may be $50 to $100 a month, but you have a $3,500 deductible. So if you're not educated enough to identify that, you don't know what a deductible means, and then your first $3,500 of costs are out of your pocket. But if you're willing to pay an extra $30 or $40 a month for the silver plan, you have a $0 deductible.
Sorry, not
So-
to cut
Maybe
you
he
off,
should come
but,
sit up here.
So I've been doing a lot of research, and it's something that I'm passionate about.
Good
and,
for you.
You know, so.
Yeah.
Yeah, I think you raised a ton of really, really good points, all valid points. I think just to help some people who haven't been doing as much research, there's different tiers in the exchange. So you can get a plan that's either as high as platinum or as low as bronze, and then if you're 30 or under, you can also get a catastrophic plan, which is under bronze. The way, like the simplest way to explain the plans, the higher.
But I think his point, I appreciate that, but I think his point is more like, not you explaining it here, but what's going on with the California Exchange, with California Downward to educate.
Right. I will cover all of it. So for a lot of people, it's important to know that if you pay more money up front, then you'll probably also pay less when you go into the doctor. If you pay less up front, then you'll probably pay more when you go into the doctor. But a lot of people think that this information isn't out there, and especially for people who haven't had insurance before, who don't know what a premium is, who are just gonna Google it, who are gonna get a 1,000 hits back and wonder what it all means, and there's gonna be a lot of fraud sites out there. I think, that's why there's organizations like ours that have like FAQs and glossaries, and Covered California also has a glossary of terms. So Covered California has a board meeting once a month in Sacramento. Occasionally they'll do them throughout the state. I think for anyone as passionate as you should totally be part of those board meetings via the telecast. You can ask questions. And every month there are lines of advocates who are asking the same questions as you. Where are the ads? Where's the culturally competent materials? They've actually translated quite a few of their materials, but not enough. Just like point blank, not enough, and not that great of quality translation. They have this master marketing plan. I was in Washington this weekend for their launch, and every other ad was about their marketplace. That's not happening here, but they did start their first set of ads. There were quite a few ads on television yesterday for Covered California. They're doing a lot on the radio, and on Spanish-speaking media, there's the ads have just flooded. As far as a list of certified entities, that is what we're all asking for. People are having a really hard time getting it. But they have released a list of organizations who are getting money to do outreach and education. There's a lot of those organizations right here in South LA. South LA is actually an area that's rich, and you can get involved by going to places like St. John's Clinic, by going to places like Community Health Council, where they are actually certified to get all of this information. And then they're going to put out this list of entities, and as a young person who wants to get involved, you can sign up to be a certified enrollment counselor, which means you'll get all the training. You have to take a test. If you pass the test, they'll give you a little card, and then once you get the little card, you can actually go and help people. Later, they're going to launch a program called Navigators, where you can get signed up to help and be a navigator. They're pushing that off until later, but that's also coming. So the information's actually out there. What's really frustrating is it's out there for advocates who do healthcare work every single day, and it's harder to find. I think you have to go looking for it, and I think we can keep pushing Covered California to put it out there, but then we also have to keep pushing to go and get it.
And it's interesting because one of you said earlier that the population that's most targeted by this is least informed and least aware. But I'm proud to say that many at USC that are involved in public policy and health research, like the Schaeffer Center and the Schwarzenegger Center, are partnered on this. And Dana and his team are doing a lot of research nationally on this. And we're strategizing having a major gathering of policymakers in the spring or in the early fall and say, okay, let's look at how much money's been given out on education campaigns. what's working, what isn't working, so that there's some accountability there and some course correction perhaps on that.
One
So-
very quick thing to add to that. A lot of attention is being paid on the first day. You know, we broke the website on the first day. And by the way, everyone uses the web. They should have been prepared for, we were averaging 5,000 hits a minute on covered California. They were only prepared for 2,000 hits a minute. They should have, estimated larger than that. But this isn't, October 1st isn't the day you have to join.
Right.
We have a 6-month period.
Good point.
And so we have 6 months for, you join, you tell your friend, the website, couple weeks, no one will be, it's not going to be so rushed.
It's
And
the
like Dana
beginning of
said, 2.5
America.
million
Beginning.
journalists will stop going online in a week or so.
All right, other questions?
There seems to be an emphasis on other providers other than doctors. Are we missing out by not granting pharmacists provider status?
That was granted today.
Oh, it was?
There you go. Ahead of your time.
All right, yes?
I was curious.
Oh, stand up, say your name.
I'm Tessa. Dana, you mentioned that you didn't think that the bill was going to move the needle on creating a healthier society, and for me, that's what the crux of this bill is. So I was wanting to understand more about that. I have diabetes personally, and I know that I have access to a lot of medicine that a lot of people don't have access to that keeps me healthy. But diabetes is one tiny example, and it's also a good example of young people not being invincible because I was healthy. But the amount of people who have heart complications, kidney complications, blindness, amputations, just with diabetes alone, because they can't see doctors, because they can't, have needles to prick their fingers, for me is astronomical. And I know I'm obviously much less educated on kind of the bill, so I was just curious, is it really, with all this prevention, all this access for people to have medicine they wouldn't have otherwise, is our society really not going to be healthier? And if so, what should we be doing to achieve
Excellent follow-up question, Dana, to
That's a
your
great question.
point
Sure.
of view that this won't move the needle on health.
Okay.
And here's an example just in one area of diabetes.
If I ask you what are the major improvements that have increased life expectancy over the last 100 years, you'd probably say things to me like clean water, clean air, stopping people from smoking, maybe some vaccines, which are very cheap, maybe a few drugs, which are also now very cheap. But it's not the expensive stuff that's driving healthcare spending. And in fact, if you look at the data, there's a 12-year difference in life expectancy between an African American who doesn't finish high school and African American male and a white male who's college educated. 12 years. That difference is not because one group has health insurance and one group doesn't. It has a lot to do with early violence, HIV at early ages, hypertension, lack of diet, exercise, no available good food in the community. So if I had started and said this is about a $1 trillion we're spending about $1 trillion over the next 10 years to enroll all these people in health insurance. Suppose I told you for $1 trillion, I'm going to go out into these communities, these low SES communities, and I'm going to change the sidewalks so they can walk. I'm going to get them fresh food. I'm going to find a way to get people to exercise. I'm going to change what's going on in the schools. I'm going to get people to stop smoking. None of that is really about health insurance, and get people educated, because remember those data. I actually suspect that you would have a much bigger effect on health. Now, it turns out when you look at the data, it is true for people with chronic illness like yourself, the availability of effective treatments like insulin or oral anti-diabetic agents affects people's health. But on a population basis, the best thing you can probably do is give people another year of education if you want to improve their health.
Thank you, Dana. We've run out of time, and we're glad to have been able to provide information to you about what is the Affordable Care Act, what's the California Exchange, and we're also grateful, Dana, to provide some of the bigger issues and challenges ahead to will this act, now that you know what it is, will it overall achieve the policy objectives?
Yeah.
that Obama and the people that signed and supported it hoped it will. And for that, stay tuned. And now we come to the part, Dan, where we do announcements. So the announcement you wish to make is about next week's. You want to repeat that?
For those of you who enjoyed and found this week's conversation as beneficial as I did, or even close to as beneficial as I did, we do this every Wednesday. Food served at 11:30 and a panel discussion at noon. Next week we'll be doing a look back at the 2012 presidential campaign with the Washington Post chief political reporter Dan Balls. With UCLA political professor, don't worry, even though she's UCLA, she's really, really smart. They both written terrific books on the 2012 campaign. So we'll be discussing not only why the Obama and Romney campaign turned out the way it did, but what that means for our politics going forward. So we'll hopefully see you next
Thank you,
week.
Dan. And if she's that smart, chances are USC is probably trying to hire her over here right now. As Dan's taught me to do, I want to also thank everyone here in the audience for coming, for caring, for your contribution. Especially want to thank our 4 remarkable panelists for the perspective and information you provided.
Thank you guys.
Dan, the Schwarzenegger Institute wants to announce that next week on Tuesday is a big day-long conference on Veterans Affairs. General Petraeus, Mayor Garcetti will be here all day. The Schwarzenegger Institute is capping the day off with an HBO documentary screening of Alive Day Memories, with a Q&A with the filmmakers and the California Secretary of Veterans Affairs following that. That'll be at 4:30 at the law school. Meebus, please stand up. She has flyers for those of you interested. And in conclusion, I will do as Dan so graciously does and thank Dan Schnur and the remarkable team at the Unruh Institute, Annalise and the remarkable partners in the work the Daily Trojan does all the time for campus and here. Thank you. And of course, our team at the Schwarzenegger Institute. So thank you all.